Thanks for taking the time to view Dr. Joe's allergy testing video. When we discuss the food allergies, I want people to understand that there's a large difference between the food allergy delayed sensitivities, for which I do most of the testing, and the stereotype type 1 histamine moderated allergy. When we say allergy, most people assume it looks like a hay fever or it looks like the rash of a bee sting. Those involve histamine and an antibody called type E. Most intelligent observers are easily able to put together the relationship between the contact and their inflammatory symptoms on a type 1 allergy. The type 3 allergy, or what is known as the antibody type IgG, is not so easy to discern. The delay in the inflammation can be up to 6 days, and the symptoms can be very generic and non-specific. It elevates your inflammation and leads to frustrating many other symptoms and issues. We do the blood test on typically 96 common foods. There are 6 gluten-containing products, 8 dairy products, fish and seafoods, fruits and vegetables, proteins, including eggs and meat, as well as some miscellaneous, such as baker's yeast and brewer's yeast, refined sugar, coffee, and cocoa. The test is easily accomplished from our little kit. We do this from a finger stick, which is very simple and relatively painless. We need only have a large enough sample to fill the end of 5 of these small strips. My patient's experience with acting on the information we get from these tests is truly significant. Because it is so hard to observe the type G allergies, it is often missed when we go about looking at our health concerns. This testing is not available through the conventional medical system, and therefore they tend to dismiss it or not include it because it is not convenient for them. The results that we find range from far beyond the digestive complaints that one would usually associate with a food allergy. Conditions such as acne, asthma, ADHD, eczema, anxiety and depression, as well as feeding the flames of hot flashes and night sweats that you might find in menopausal symptoms. By identifying the foods that are causing inflammation in any individual, we can reduce the severity of many other medical conditions. We also have strategies to manage the occasional exposures that one may have while trying to avoid these foods. And as a naturopathic doctor, we're trained to intelligently talk about ways to substitute for the popular food groups that are the most common allergens. Those would include dairy, wheat, and eggs, and we can provide information on how to create alternative recipes that provide all of the important nutrients into your diet while avoiding those inflammatory foods. I hope this has been helpful. If you would like any more information, we are always happy to entertain your calls or electronic inquiries. Thanks again.